This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
And welcome to a brand new program here on News Radio 1080 KRLD. My name is Thomas Miller, and it's a privilege to introduce you to Stephen Love. You've heard him here on many news interviews and other presentations. He is the president and CEO of the DFW Hospital Council.
Thanks so much, Thomas. This is going to be a great show, and we're really looking forward to it. I do want to tell you a little about the Hospital Council. We're made up of 90 hospitals here in the Dallas-Fort Worth area, and we have an array of hospitals. We have public hospitals, investor-owned hospitals, faith-based hospitals, community hospitals, rural hospitals, long-term acute care hospitals. So we have a good variety of hospitals, and the purpose of this program is to help showcase and explain to our listeners some of the good things that are going on within North Texas, and our hospitals are giving back to the community. It also is to help our listeners understand some of the programs that we have at our various hospitals, whether it be mental health programs, it could be orthopedic, it could be cancer, but it's really to let the listeners know that we care about the health of the community. And this show is not going to be political. You know, we treat Democrats, Republicans, independents in our hospitals.
All of them come in.
We treat them all. So we're not going to take sides in politics. However, we are going to highlight some of the areas that we hope to educate people on related to healthcare. But this show is going to be fun. It's going to be one that we look forward to having different segments, and so we can showcase many different activities throughout each hour that we have. And we want to make sure that it's informative for the listeners. And we want the listeners to hopefully obtain from this program information that will help them make better informed decisions about their health care.
You know, what is known as Obamacare, we'll talk about in a minute because that's front page news right now. But healthcare has been changing over this past decade. Yet when we go to the hospital, we might not recognize some of the changes. I'm sure that we're going to talk about some of those as we peel the covers back, if you will, and look at what's going on within the system. We'll really be enlightened to some things that are going on that we might not have otherwise realized.
Oh, absolutely. You know, Thomas, I'm an old guy. I've been around a long time.
Hey, you're not that old.
Yeah. I have worked in hospitals for a number of years. I've been here at the Hospital Council about 13 years. But let me just tell you, healthcare is always changing. And the innovation, the technology, the research is just tremendous. I can give you some examples. I remember early in my career, if you had gallbladder problems and you had to have gallbladder surgery, you were admitted as an inpatient, and you might actually be in the hospital 2 or 3 days just to have that surgery. We all know the changes that took place there, where you now have gallbladder surgery as an outpatient with a very small incision. That's kind of an example that people identify with, but many different methods related to treating diseases change frequently. And we hope, ultimately, it's going to be the best quality and the best outcomes for the patients. And this show is going to help promote and hopefully educate the public on some of those changes.
So we've been with this new dynamic in healthcare for a decade now, Obamacare. We'll talk about some more of that in just a few minutes. But one of the things that I know was the conversation back then was, how are we going to deal with these changes? One was prevention is going to be key. Second, awareness, knowledge of the system is also one of the key ingredients. We're certainly going to take care of number 2, aren't we?
We certainly hope so. We hope that we're going to do that and do it in a way that our listeners really comprehend. We're going to try not to use too much medical jargon. I'm not a clinician myself, so we're going to try to make this something that is fun, but also informative.
Now, something we were informed of in late December, just a couple of weeks ago, is that the ACA, the Affordable Care Act individual mandate, is now declared by an appellate court unconstitutional. That means it will be appealed directly now to the Supreme Court. What does that mean for people's health care? What are some of the issues, and what should we be watching for as this story unfolds?
Well, the first thing, we don't want people to panic. And as we look at what the appeals court said, they said the individual mandate was unconstitutional. That's a component of the ACA, which is part of what you call Obamacare, the Affordable Care Act. And what they essentially did was send it back to the lower court to look at the entirety of the law to see if it's unconstitutional. Now, with that said, the ACA, as is still the law of the land. People that have enrolled in health insurance marketplaces hopefully will continue to do prevention and wellness and have coverage and access, and all the components will continue. Now, what would happen if the entire thing was ruled unconstitutional is a number of people would be affected. There are many people, approximately 18 million, that gained coverage since 2010 when you mentioned that the law passed. Almost 54 million Americans with pre-existing health conditions are now protected. And we've expanded much of the coverage, some through Medicaid expansion, etc., and through the health insurance marketplaces to help people. So where do we go from here? First, as I said, we still have the Affordable Care Act in place, and people should not panic. Second, we'll wait and see what the lower court says about the entirety of it. But the California Attorney General, who really has announced and supported the law that's currently enacted, wants to have the Supreme Court intervene. Now, in talking with the American Hospital Association, they feel the earliest that the Supreme Court would intervene would be October of 2020. So let's don't panic. Let's continue down the road of the Affordable Care Act, and we'll see how this unfolds. Again, we're not going to get into politics on this show, but the last thing we want is our listeners to panic and think they're going to immediately lose coverage. That's just not the case.
Well, and you're talking about steering the Titanic, not a sports car. So even if they talked about this fall, it's probably not going to affect the industry. Couldn't react quickly enough for 2021. So really, this is a long game.
Yeah, it should be, and that's why I don't want listeners to panic, because whatever is done and whatever the outcome, we'll have to wait and see. Hopefully there will be a long enough time frame that we could adjust and make changes as needed. But probably it will be after October of 2020. We'll just have to wait and see.
You are listening to Stephen Love. He is the president and CEO of the DFW Hospital Council, and you are going to hear some wonderful nuggets in this show. When we come back, we're going to talk about one of the most pressing medical issues in the Metroplex and what one hospital system is doing about it. You're listening to the human side of healthcare on KRLD and radio.com.
This is the Human Side of Healthcare show on KRLD, where we feature healthcare's hottest topics and what our area hospitals are doing to make healthcare human again.
This is Steve Love back with the Human Side of Healthcare, and I am absolutely delighted to have Dr. Donald Wesson with me. He's president of Baylor Scott & White Health and Wellness Center at Juanita J. Craft Recreational Center, and is doing a lot of good work for Baylor Scott & White, especially in the wellness. So, Dr. Wesson, tell us a little bit about Baylor Scott & White Health and Wellness Center.
The Health and Wellness Center is a public-private collaboration between the City of Dallas Park and Recreations Department and Baylor Scott & White Health. The original collaboration, which started in 2010, was focused on providing community-based diabetes care, but we now treat and manage and do research on all chronic diseases. But diabetes is still the main disease on which we focus. And so we've recognized that the management of chronic disease, which is the big concern that in our society now, is something that requires a village. So just like that West African proverb that says it takes a village to raise a child, we say it takes a village to do health. So we have a collaboration between a number of entities, most notably Baylor Scott and White Health, Dallas Park and Recreation, and our food distributor, because that then points out the three elements of health, not just health care, the three elements of health that comprise the work that we do: medical care, nutrition, and physical activity. We don't use that four-letter word exercise, physical activity.
That's some good points. And, as you look at the good work that you're doing in the community, how did this originate?
Well, in 2010, like most health systems, Baylor Scott and White Health looked at the expensive to manage disease processes that it was having to deal with, and diabetes was at the top of the list. And when they looked at where these expensive to manage patients came from, they came from 5 zip codes in southern Dallas. And so this center, the Baylor Scott and White Health and Wellness Center, is at Juanita J. Craft Park and Recreation Center, which is in the middle of those 5 zip codes, with the highest rate of providing expensive to manage diabetes patients to the Health and Wellness Center and to Baylor Scott and White overall. And then when we look at the data more broadly, that's a hot spot for chronic disease overall. So it's not just diabetes, also high rates of my particular interest as a kidney doctor, chronic kidney disease, high rates of overweight, high rates of all chronic diseases. So that's why we expanded our mandate beyond diabetes to include chronic disease overall.
You mentioned those zip codes, and you mentioned the area that you're really focused on. Can we drill down a little bit more and talk about the community you serve? And can you talk a little bit more about a little more detail related to your programs?
Well, the communities that we serve, as I mentioned, have high rates of chronic disease. And chronic disease is what's really contributing to the health concerns of the nation overall. And the data would suggest that communities like ours, which are low income, highly concentrated in urban, largely African American and Hispanic, those are the criteria that would predict communities that would have low health care access and high rates of chronic disease. So those are the characteristics of the community that we serve.
So let me ask you this. Do you serve children, adolescents, adults, or do you look at particular age groups that you serve?
So we serve primarily adults. We have what we call a tweeners program, where we look at middle school students in an effort to not only address their health needs, but more importantly, to educate them regarding the importance of nutrition, physical activity, and having a healthcare professional connected to them and their family. So although we do provide services for that middle school age group, it's primarily directed at a way by which to get to their families, to educate them as to the issues of health that I just described. But overall, our primary focus is adults with chronic disease.
So let me ask you, you mentioned, and we certainly understand the need for healthy food. Healthy food is an integral part of, as you say, not only looking at health, but making people have healthy lives. Do you help educate about food, or do you actually help supply healthy food?
We do both. I'm glad you mentioned that. So our farm stands, which we set up in not only at Juanita J. Craft, but at 3 other park and recreation centers and 4 local churches that we partner with. These farm stands provide strategically selected produce, fresh fruits and vegetables that manage the three primary chronic diseases that we focus upon: diabetes, overweight, and chronic kidney disease. So these foods are selected in particular for the management of those diseases. And so when our participants show up at our farm stands, they not only get these very low-cost, strategically selected fresh fruits and vegetables, but they also get education as to their preparation and their selection. So you have diabetes. These are the foods that work well in helping to manage your diabetes. You are overweight. These are the foods that provide you with good nutrition and fewer calories. And so they get the education and the food. So that's why when we talk about our nutrition program, we talk about provision plus education.
That's excellent. And, you know, you mentioned also as you work with people and you're looking at the wellness aspect and obesity, are there specific wellness type programs and activities you do to work with obesity other than the healthy diet you just mentioned?
Absolutely. So the diet is certainly a key component, but increased physical activity is a key component too. Again, some folks use that word exercise, but when we are talking about moving, we're talking about increasing our physical activity. So we have various physical activity programs that are based at Juanita J. Craft, at other park and recreation centers, but also at many of the 31 churches with whom we partner. And so the key for us is not just having them participate in these particular programs on site, but to teach them as to how to increase their physical activity in a healthy way outside of our centers and in their homes and in their neighborhoods. And then secondarily, to educate their families as to how they can move in a healthy way that contributes to improvement and management of their chronic disease issues.
You know, you mentioned it takes a village. So our listeners that are listening, how can they get involved? How can they help?
Well, the village it includes entities outside of Baylor Scott and White Health, outside of the health system. So that's part of the innovation of what we do. We've had to learn how to partner with other entities.
Thank you so much, Dr. Wesson. We appreciate you being on the show and contributing to the human side of healthcare.
Thank you for having me.
So, listeners, please stay with us. Our next segment is a very important segment. It's important for parents. It's important for relatives. It's important for school officials. Thomas, it's important for you and me to understand this next segment.
You know, my kids are both up and out, and I've got to say I could get down on my knees and be thankful that I did not have to deal with this, but we are talking about teen substance misuse.
Yes, and you know, I think as we bring in our expert from Children's Health, you're going to learn how things have changed over the years. You know, we think in terms of substance misuse, and you know, when I was in college many years ago, substance misuse was different than what it is today. And I think we really need to listen carefully to how things have changed, and we really need to listen to the experts on some of the things we need to look for. Some of the signs, Thomas, are incredible.
Yeah, so if you're dealing with this in your family, or you know a family who is dealing with this next segment coming up right after our break is going to be very important for you.
And we're going to have Stacie, Goran, the manager of Teen Recovery Program at Children's Health, with us right after, which is next, Traffic and Weather Together on the 8s here on KRLD. Welcome to the human side of healthcare, and we're delighted to have with us Stacie Goran today from Children's Health. Stacie is the manager of the Teen Recovery Program. And you know, Stacie, as we talk about children, adolescents, teens, many people don't realize some of the problems they have, not only in behavioral health, but also in recovery, substance misuse. What really are some of the trends you've seen in substance misuse among the teen population?
Right now, we're working in an outpatient program. I've done the residential side of substance use treatment and outpatient. Currently, in our outpatient program, 100% of the kids that we're seeing are using cannabis, so marijuana in some form or another. Some of the other trends that we see often are benzos, so the Xanax abuse. Also, they abuse stimulants like maybe taking a friend's Adderall or abusing their own prescribed Adderall that they have for ADHD. So that's what we see typically. We do have some that will occasionally be positive for cocaine, methamphetamine. Also, cough syrup has come up and been really popular lately. We don't see it on our immediate drug test, but when we suspect it, we can send those tests off, and that dextromorph I'm going to mispronounce that word, but DXM is like triple C's is what they often call it. It's Coracetin, cough, and cold. So those cold medicines are often abused, and they do it because they think that they can get away with it. The teens will do a lot of things just because they think they won't get caught. So that's what we find is often they'll try to get away with things that won't be caught on a drug test.
You know, you mentioned a couple of things as you were going through your answer there, and it triggered thoughts. We're going to do another whole show related to vaping and e-cigarettes.
Mm-hmm.
But you mentioned cannabis.
Right.
And you mentioned some other drugs. Not only in vaping are we running into situations where kids vape using the products that they purchase, but then they're taking some of those and putting cannabis and other drugs in them. Are you seeing any of that?
Absolutely. We often have parents that come in and they will show us the things that they've found in their teen's room. I ask them not to bring that stuff in and maybe take a picture and send it to us instead. But often it is THC cartridges, and they're not aware of that. Maybe they just think they're vaping flavored oils or just nicotine, and so they think it's fairly innocent, but often it is the THC cartridges. The other thing is dabs. They refer to it as dabs or wax or butter. They even call it butter. It kind of looks like a waxy substance, but it's a really high concentrated version of cannabis. So they extract the THC from the marijuana. Regular marijuana that we've known for many, many years, probably up until the 90s, was about 10% potent THC at the most. In the 90s, they started doing the hydroponic growing where they grew it indoors. They got it up to about 20% potent. What the kids are having more access to now is the concentrates. They are up to 90% potent THC. So often we have the kids that are saying it's just weed, and I do that in air quotes. It's just weed, but it's not. It's up to 10 times more potent than what anyone knew as weed before. And so the kids are having a lot of symptoms such as psychosis, losing weight, they're not eating, they get much more addicted much more quickly when they're using the higher concentrates. And so we're seeing that with the oils and the dabs. So both of those are very, very popular. And we found that if the parents know that the kids are vaping, and we dig in or we do a drug test immediately, most of the time they're going to come up positive for THC.
Wow, that's amazing.
Mm-hmm.
You know, Stacie, I'm an old guy. And yes, when I went to college, marijuana was around, no question about it. But let me ask you, how in your mind has cannabis changed over the past few years? And the reason I'm asking that, in some places it's legalized. It's not as criminal as it used to be in other states. Can you give us your perspective on the changes related to cannabis?
I think that's a really important point. I think in a lot of people's minds, it is less destructive, or people just are a little bit more dismissive of marijuana use because they hear about the legalization in other states. Well, if they're legalizing it in other states, it must not be that bad. But it is more powerful, you know, as we talked about with the potency, but also it's coming in all kinds of different forms that weren't available before. You know, you talk about your college days. If in my college days, they had talked about edibles. It was a brownie with the flour actually in the batter. It tasted awful. I mean, you knew for sure what you were eating was not just a regular brownie. What they do now is they take the THC and they put it in actual butter or cooking oils, and then they cook the cookies or the brownies or the candies or whatever it is. And so kids are having more access to edibles. We see candies like that look like gummy bears or cookies. The displays when you go into these dispensaries in other states, and I've looked at some of the pictures, it looks like a candy display that you would see at a grocery store that was aimed or geared towards children. And so it's really scary when you think about it that way. And those are more accessible now, even in Texas, even though there is no legalization here, because they're bringing it from other places. So it is here, even though it's not legal here. And then the decriminalization, the kids know I'm probably not going to get arrested now. I might get a ticket, and that's where the decriminalization comes in. It's still a charge. You're still going to get a ticket, but you're not going to get arrested the way you would have 10 years ago. Right. And so it is just, it's looked at as just less of a problem.
Yeah, you're right.
Yeah.
You know, I mentioned when I was in school, if you were caught with marijuana or using it, with pretty stiff penalties back then. Mm-hmm. So let's step back a minute. And if we've got teen use of marijuana, cannabis, how does that impact the brain of a teenager?
You know, our teens that we work with, many of them do have mental health disorders underlying. So maybe ADHD. We have a lot of kids that have some impulsivity related to their ADHD diagnosis, maybe some anxiety, maybe some depression that's underlying. So it impacts all of those things. And substance abuse and suicide are correlated the same way depression and suicide are correlated. So it is really, really scary. And so that's why this clinic came about, is to treat the substance use with the mental health and not look at one as more important than the other. And they're both really important to their mental health.
You know, you gave us some good information there, but one thing you said that is so important. There is a correlation between substance misuse and teen suicide. That is something that's quite significant, which brings me to my next point, parents. You know, parenting is tough, but also being an adolescent is tough. Peer pressure, lots of things. What should parents notice about their children? And by doing so and observing, when should they make that decision? We need to seek professional help for our child.
I think the first thing that I would say is we get a lot of calls where we caught our kid using, you know, he came home and I'm pretty sure he was using. I'm pretty sure he was high. His eyes were red. He wouldn't look at us. He denied any use, but we really suspect that something's going on. We know, working in this field, that it's really unlikely that it was the first time. It's never too early to get help. You know, you might start with a pediatrician, and I've told parents that when they called in, they're not sure. They suspect that some things are different. Their friend group might be different. They're avoiding some of their regular extracurricular activities. They don't want to do football anymore. They don't want to go to their church group anymore. They just don't want to be involved in the things that were really interesting and fun for them before. That's a huge sign. A good place to start, like I said, is the pediatrician. Pediatrician can do a drug test on the spot and see, is there something that we need to be concerned about? You know, THC stays in the system for a little while, up to 30 or 45 days, depending on what they're using and how often they're using. And so you can catch that. And if you see that, it is never too early to get help. 9 out of 10 adults that seek substance use treatment started using when they were adolescents. And so we can look at that and say, if we can intervene when they're an adolescent and not let them get to that point as adults where their consequences are much more severe as adults, you know, they may or may not have lost a job, a spouse, their kids. It's a little more difficult because they're less motivated for treatment often as adolescents, and we get that a lot. Well, he doesn't really want to do treatment, so I don't think we can force him. I just tell him this is the only time you'll be able to force him. You know, once he's 18 or she's 18, you will have no say in whether they get treatment or not. And so this is the time to make them get treatment. Even if they don't appear to get better right away, they're soaking in the things that they're learning, and we're going to hope that they can apply those later and they won't end up in a really bad situation as an adult.
You know, Stacie, that's good information. And for our listeners, And we're not here trying to promote one hospital over the other or
Right.
anything like that. We're here to try to help improve the health of the community. So as a parent, if you really are seeking help, who should you contact?
I think the first stop is the pediatrician. I think if the pediatrician feels like you need to follow up, then I think a therapist would be a great next step. If they're in therapy and you feel like things are not really getting better, then intensive outpatient is really the next step, where they do a peer group with a therapist and they can really work on some of those skills that they'll need in order to be able to refrain from using and then also improve some of their mental health. If it's gone beyond that, the next level of care is a residential treatment center so that they can be away from their environment for a while, maybe get their head on straight a little bit and learn some things where they're inpatient 24/7. And we send a lot of kids to residential treatment centers because they need to get away from their friend group and really need to be removed from even their home and their school life for a little while to focus on themselves.
Stacie, I just want to thank you. This has been a needed discussion. Listeners need to know about teen recovery. They need to know about the warning signs. And hopefully this broadcast today, if anything, will help people seek the treatment they need and understand it's all of us working together to improve the health, not only of our children and adolescents, but everyone. Thank you for what you do.
Thank you so much. I appreciate being here.
And you're listening to the human side of healthcare. The next topic we want to talk about is a very serious topic, and it's a topic that impacts all of our young people. And it's something that is growing in epidemic proportions. That's the use of vapor products and specifically e-cigarettes. This week, President Trump has addressed the flavors, and our state legislature next session is really going to get after this issue. We're delighted to have State Senator Nathan Johnson with us today. He's a real advocate to have stricter legislation to protect our teens. Senator Johnson, a pleasure to have you with us.
Thank you for having me, Steve.
So as we look to the future, the next legislative session in 2021, what do you think about vaping and what we should do?
Well, I think it is time that we do something. You know, we tried to do something last session. We had a bill that would have attempted to reduce the sales of vapor products to minors. And that's really what we're trying to do. It's what we need to do next session. We're not trying to stop adults from making their own decisions. We are very concerned about young people in days when they have not really figured all of life out, becoming nicotine addicts, because it's very difficult to make decisions later. What we need to do is reduce sales to minors. And the way we are looking to do that is to treat vapor products more like we do traditional tobacco products. And that has to do both with enforcement and revenue and all sorts of incentives and advertising. So to start with, we need to treat vapor products like we do tobacco. What we really need to do is make sure that there's an incentive for the vendors to comply with the law. It already is the law that you cannot sell vapor products to minors. We did have a good law passed last session where we raised the age of smoking and use of vapor products from 18 to 21. But we still have the issue of, if you are a vendor and you sell to a minor, what's the consequence? Well, if you sell tobacco to a minor, you could have your sales tax permit revoked. If you sell vapor products to a minor, no such consequence. Maybe a fine, maybe if they catch you. So one thing to do is to start treating vapor products like we do tobacco, in that there's a consequence. You could have your sales license revoked. So that's the first thing to do, so that vendors think twice before they sell to minors. The second half of it that we've discovered only since last session, we were looking at the enforcement when it comes to selling tobacco products to minors. And we discovered that never, ever in the history of Texas has any vendor had their permit revoked for selling to minors.
Make sure I heard that right. Are you saying in the entire history of Texas, for selling tobacco products to a minor, no merchant has had their sales tax license revoked?
Never, ever in the history of Texas.
Wow.
Has anyone ever been caught selling to minors? Yes, a number of them have. Some of them have been caught selling twice. So why has there never been a license revoked? And that's because the statute requires you to get caught selling tobacco to minors illegally 4 times in a single year. or 7 times in a 2-year period. That's just way too lenient. It's especially lenient when you consider the fact that we have so few enforcement resources. For law enforcement to go into a store and catch them 4 times in a year is just so improbable that you might think it would never happen. And in fact, it never does happen. So if we tax the sale of vapor products and we use some of that money for enforcement, or we take some of the tobacco tax and use that money to support enforcement, we can catch more of the vendors who are selling to minors. And then we take the statute and roll it back. Instead of 4 times in a year, what about twice? Don't sell to minors. If you do it, you can't sell at all. I think those are very reasonable changes to our code.
Yeah, that makes sense. And, I talk to people and they say, why hospitals and why are you, Steve, so interested in this electronic cigarette and vapor issue? Well, hospitals care about the health of their community. And even though long-term research isn't in, we do have enough indications just from people that have visited hospitals in North Texas that there are dangers associated with vaping. Question I was going to ask you as we look at regulating it, would that include internet? I went on the internet the other day, the reason I'm bringing this up, and I was asked a question, am I 18 or 21? In my dreams, but I'm not. And so I went through it. But if a minor said, yes, I'm 21, they could purchase e-cigarettes, vapor products off the internet. Can we regulate that?
That's very difficult. It is very, very difficult. There are ways that we're looking at right now. I am not real optimistic that that's the way we're going to make the most progress. Fortunately, more than 3/4 or about 3/4 of all sales of vapor products happen through brick and mortar stores. The typical way that kids get it is they go in and they purchase it illegally, or they have a friend who's 18 or these days maybe 21 who buys it for them. What happens when it becomes the internet? That's another level of enforcement that we'll have to approach. It may have to do with enforcement after purchase. But as far as the purchase on the front end of it, I'm going to be concentrating on the brick and mortar stores because that's what I can control better.
Another thing, and I totally agree with you, and I think, the hospital council would certainly support, we're not saying ban products, and we're certainly not saying we're going to prohibit things, because I'm sure there are some adults, especially that have used electronic cigarettes and vapor products to step down from combustible products and hopefully use it as a way of smoking cessation. And to those people, we certainly commend. However, good news this week, President Trump wants to eliminate flavored products and vapor cigarettes, and we're delighted to hear that. It's a step in the right direction. It does not go into effect immediately. As you know, it has to be published. It's in the Federal Register, et cetera, et cetera. But this is a step in the right direction to remove these flavored products. We do wish it included menthol. It doesn't, but we're making progress.
There's no question. This is trying to create your future market, right? These are aimed at young people, without question. So could we regulate the packaging? Could we regulate the use of flavors? I do think that's another area where we ought to be looking. Because again, we're talking about kids here, and we don't want them to get hooked on a product because it's cool or because it tastes like bubble gum or it tastes like bananas. I'd rather they eat a banana than smoke one. So I just think that we do need to take a very serious look at how these things are marketed. And so thank you for bringing it up. That is another element. Let's regulate the marketing of these products just like we do other products.
You brought up an interesting point about the banana, but all kidding aside, I was on the CDC website the other day, and they were talking to a physician who said many of the flavors may be good food to eat, but not necessarily to inhale. And said the dangers are some of the particles that come through the vaporing can do permanent damage to your lung capacity. I also read where in Michigan there was a survey done, and from, I believe it was 2017 to 2019, 8th graders, 10th graders, 12th graders, the use of vapor products had doubled. And so the percent continues to go. So let me ask you this. As far as you in your role as a state senator, what message would you have for your young constituents about vapor products?
Slow down. Take your time. There's a lot of ways you can have fun with things. You don't need to make this decision today. In fact, it's certain that being a nicotine addict is going to be baggage on you for the rest of your life. This stuff contains nicotine. Nothing's free. You can't get a free buzz. You're going to be stuck on this thing. It's going to cost you money. It's going to cost you your health. Slow down. Take a look at who you want to be when you're an adult, and then make these decisions. Maybe you are addicted to nicotine, and maybe you want to use vapor products to wean off it. Some people think they don't work. Maybe it works for you. That's a call for you to make a little bit later. But right now, take a breath of clean air. Just because something is not harmful if you eat it, as you said, Steve, it might be harmful if you smoke it or if you inhale it. These things weren't made to go into your lungs. So don't move so quickly and so dismissively of your own health. So the last thing I want to say is remember that this body that you occupy, you're borrowing it from your future self. Your future self has to use this body for another 60 years. And when that 50-year-old looks back at this 16 or 18-year-old, what's he or she going to say to you? Is he going to say, thanks for taking care of this body? Or are they going to be mad at you for trashing it? Take good care of yourself.
Excellent advice. Senator Johnson, we want to thank you for being on the show, and we know that you're committed to the health of not only your constituents, but to the people of Texas, and especially to our young people.
Thank you very much, Steve. It is an honor to be here with you and with the Dallas-Fort Worth Hospital Council.
Thank you for listening to our inaugural show. Hey, we want to hear from you. You can email us at radio@dfwhc.org. So we'll see you next Sunday at 1 on KRLD and radio.com.